Hi, this is Dr. Lee from Integrative Solution for the Ankle. Let's talk about one of the most commonly asked questions to me. Let's talk about high arch foot and flat foot, so stay tuned. Alright guys, so before we start, make sure that you subscribe to the channel and you like this video. We upload content on a weekly basis. We have a lot of case studies and then we also have a lot of vlogs, so you'll be able to utilize this information from this channel and improve your foot and ankle health. So thank you very much. One of the most commonly asked questions to me is, why do I have a high arch foot or why do I have a flat foot? So want to be able to kind of address these questions to you guys so you guys can have a clear understanding exactly how you can have different kind of foot shapes. So number one reason why you can have either high arch foot or flat foot is by genetics. What that means is you have flat foot or high arch foot because either one of your parents have it or both of your parents have it, or it runs in your family, or your grandparents have it. What it means is there are genes running in your family or in yourself that actually allows you to have flatter or higher arch foot than most people. That actually is one of the most common reasons why you can have different foot shapes. Just like how you have the different hand shapes or arm shapes, foot is no different. We are dictated by genetic components to it. Number two reasons why you can have different foot shape is due to structural differences. Not everybody's built the same. Some people have differences in their structures in the pelvis, their low backs or their mid backs, or their legs and their thighs. So different skeletal or muscular structures can definitely impact how your foot is going to be shaped. That also dictates how you'll be walking. Different type of walking is due to different structures, and different foot shape is also due to different structures in our body. Number three reasons is diseases. So certain type of diseases are predisposing you to have certain types of foot shape. What I'm trying to tell you is it may not necessarily be dictated by your structures or your genetics, but diseases, depending on what type of disease it may be, it can definitely impact your foot shape. Another reason why you have certain type of foot shape is because you had some kind of traumas in the past. So if you had some kind of traumas to the foot previously and altered the structure of the foot, you can definitely have certain type of foot shape. Please understand those four reasons that I've stated before are the older reasons why you can have certain foot types. Those are only the small part of the large examples why you can have a certain type of foot shape. When you have a certain foot shape, it's not more than just one factor that you have to look into. It's multifactorial, which means there are more than one reasons why. We just talked about how you can get either flat foot or high arch foot. There's one more component we have to discuss when it comes to high arch or flat foot. What is it? It's actually the flexibility. The flexibility is a really, really important component, and then it helps me as a foot doctor differentiate exactly what the problems are and how I'm going to solve it. The flexibility with either high arch foot or flat foot is as follows. For example, let's say you have a high arch foot like this. When you're walking, if you have flexible high arch foot, when it actually contacts the ground, your foot is going to accommodate to the ground striking, which means you're contacting the ground, your foot is touching the ground, and it will make all the necessary adjustment in your feet to be able to absorb the shock coming from hitting the ground. Somebody with high arch foot but have a rigid foot, when they have a high arch, when the ground is contacted by the foot, it does not budge. The shock coming from hitting the ground is not going to be absorbed by flexibility of the bones. So that actually tells me something else about the problems of the person's foot. One of the most commonly asked questions as a foot doctor by my patient is this. Dr. Lee, I have a pain over here. Is it because I have a high arch foot? Dr. Lee, I have a pain over here. Is it because of my flat foot? So I want to be able to just kind of go over with you guys exactly where you typically have pain with either foot type. So I want to be able to break it down and then kind of discuss this with you guys. Please understand that this is a really boiled down version. It may not be accurate in every single instances. Besides, when you start to calculate the factors of either flexible or rigid foot, there are also different kind of factors that I will have to calculate. So please understand this is going to be entertainment purposes only. So please consult with your doctor for further evaluation of your foot and ankle problems. So let's start. So let's talk about high arch foot first. High arch foot means you have a foot like this and with a high arch in the bottom of the foot like this. So when you have high arch foot, you typically experience pain on top of your foot. The reason being is because, for one, your high arch may be rigid, which means it doesn't really budge as much. Also, another really common causes for people to have pain right here is because their shoe and their high arch foot always collides. So this is usually the painful spot for somebody who have high arch foot. Secondly, I see a lot of people with high arch foot having pain right here. Right here. It's called metatarsal head. It's a fancy term for between the end of the toes and start of the foot. So that's exactly where a lot of people have pain. The reason being is because when you have a high arch foot here like this, you notice that how your toe has to just kind of prop up to be able to kind of hit the ground. So that kind of an acute angle or high angles between this bone and this bone right here, this bone called metatarsal and this bone called phalanges, that high angle creates a lot of high tensions and pressures. So I tend to find a lot of swellings or pain in those areas in metatarsal heads and high arch foot. A lot of times people with high arch foot, their back of the foot, the rear foot, is actually twisted inside most of the time, at least from my clinical experiences. What that means is they have a lot of pain from the muscles or tendons running from the inside of your leg down to your foot, and also this portion right before your arch starts. This portion tends to be a little painful and also achy. It's something that I do find a lot on high arch foot patients. Once again, this type of pain points are varying from person to person. It may not necessarily be accurate because you have to calculate all other factors. But those are the most common signs that I've seen in my clinical experiences in the past. Okay, so we talked about high arch foot, so let's talk about flat foot. Okay, so flat foot means what? You have lost the entire arches and your foot is flat, it's a flatbread. So like this, very flat. So when you have a flat foot and you have no arches, your pain points are slightly different. Remember how I told you high arch foot patients actually have pain at the top of the foot? Well, the flat foot patients usually have pain at the bottom of their foot. Also, concurrently, people who have a flat foot and have been walking for a long time, running for a long time, they also suffer from what we like to call plantar fasciitis. Plantar fasciitis is the fascia that runs from the bottom of your heel all the way to this region, the start of the toes, and then that actually can be inflamed, torn, especially with flat foot patient. High arch patient, especially when they're flexible, they can still get it. But it seems to me that a lot of the flat foot patients are more prone to injuring these areas. Secondly, a lot of flat foot patients actually have pain outside of their legs down to their third and the fourth and their fifth toes. So when you have a flat foot, it seems like your back of your heels are twisted outside, which means that you start to have spasms or dysfunctions of muscle called peroneals, and muscles that actually runs from the side of your leg down to your third and fourth and fifth toe. So this area is right here. They tend to be painful, they tend to be spastic, they tend to be problematic in flat foot patients. Both high arch foot and flat foot are biomechanical or structural problems of the foot. If the structural problems like flat foot or high arch foot does not get corrected for a long time, other problems can also be happening at the same time. One of the more common things that actually happen with long time flat foot or high arch foots are bunions and hammer toes. What are those? Bunion is your big toe, your hallux. When you start to drift away, drift inside here like this, you start to get a little bump right here. Well, this bump right here can also grow and become a painful bump. It can be very painful when you wear shoes. Now that's called bunion. And that's one of the more common problems that actually people have in their big toes. Hammer toe is when your toes curl up like this. Happens really frequently on the small toes, 2, 3, 4, and 5. It can sometimes happen to the first toes as well too. You have a curling up of the toes because you don't have as much traction. You cannot really grab the floor as easily. You cannot really grab the floor ground as easily because biomechanical changes either with a flat foot or high arch foot does not give you enough stability of the foot. So those two things are actually very common in a lot of people, and those things can become problematic of its own if the either high arch foot or flat foot does not get corrected for a long time. So I just told you about high arch foot and flat foot, and I also told you about how you can get it And I also told you about a little more about biomechanical changes with high arch or flat foot. And I also told you about painful spots or what can happen if those things doesn't get corrected for a long time. Now it's important for me to be able to really tell you this. Foot pain or foot problems are not the same. What does that mean, Dr. Lee? You can have all the foot problems in the world. In fact, I've seen people with extremely high arched foot or extremely flat foot. I've seen people with extreme bunions and extreme hammer toes, and they have no pain at all. They have zero pain and they have no problem functioning in their daily life. Yet I have seen people with a very small amount of bunions and hammer toes or a very small amount of high arched foot or flat foot, giving them a lot of pains in their daily lives. So when you're looking at the problem, it's different from looking at the pain. The pain, you really have to look at the entire global structures. What does that mean? When you're evaluating for pain, you have to look at the entire body of a human being. You have to look at all the associated structures like leg, thigh, knee, low back, hip. All of those can actually contribute to your foot pain. Just because you have a high arched foot or a flat foot, it does not necessarily mean that you're going to get all the pains in the world. It all has to be case by cases, and then depending on what else is happening to the entire body. Thank you very much for watching this video. If you have found this video to be useful, please like this video and subscribe to the channel. We'll try to bring more useful contents to you on a weekly basis. And please stay tuned to more vlogs for this coming year. We'll try to give you a lot more detailed and then thoughtful information so you can really understand foot and ankle health and then improve your own foot and ankle health. So this is Dr. Lee from Integrative Solutions Foot and Ankle. Be well.